Hello, Dr. Brad Hustlebus here, chiropractor from Rockford, Illinois. Come at you with another episode of Ask the Chiropractor. So I've always felt like if you want to ask a chiropractor a question, you should always ask a chiropractor. It's always been a pet peeve of mine when you see something that about a chiropractic, they tell you to check with somebody other than a chiropractor first. Only chiropractors know what chiropractors do. So if you want to find out what a chiropractor does, ask a chiropractor. You want to know about your teeth, don't ask your family doctor, ask a dentist. So we're here to talk today about a question about children in chiropractic care. And what's the difference between how you take care of an adult as a chiropractor versus how you take care of a child or even a baby as a chiropractor? What's the difference in the way you adjust them? What's the difference in the way that you progress their care? How do you know the care they need compared to adult to a child? And this is a great question that we were asked by a patient. So let's first take care of maybe a situation you're having a problem. Maybe number one, kids get chiropractic care. Why would a kid need chiropractic care? No, this is a common question that we get asked from the insurance companies all the time. Why would a kid need to go to a chiropractor? And I always just laugh at that. Why would a kid need to go to a chiropractor? Have you ever watched a 6-year-old run across a parking lot? Hmm? What do they always do? It's not a question of are they going to fall and stumble, or it's when they're going to fall and stumble. You watch a 20-year-old athlete run across the parking lot, they're not going to fall. You're not worried about them. But the 6-year-old, you know, it's just a matter of time before they trip over their own feet, fall, and start crying. I have 4 kids. I've raised them. I know how that works. So kids fall and tumble, and they spill all the time. I did a video a while back on growing pains, how the kids can grow misproportionally, left side versus right side, and how that messes with coordination and everything. So yeah, kids need to go to a chiropractor. You know, I think it's crazy to think that a child wouldn't need to go to a chiropractor because they're still growing. I mean, they fall, they hurt themselves, they get a misalignment, they keep growing that way. I don't think so. And as far as like the science behind it, you know, we go to chiropractic school. We know how to take care of kids. We have a whole class on it. When I was at chiropractic school, my step nephew was there, and I got to see him in the clinic working with the special doctors that have advanced in studies in pediatrics. Here at this office, we've taken classes with the International Chiropractic Association on pediatrics, and we've also taken some from a different association, the ICPA, and we've learned how to take care of kids. We've learned the differences and we learn how to analyze them. In order to finish one of these courses, like these pediatric courses, you actually have to commit research. You have to either write a research paper or do a research project yourself. I've done several here, working with the different groups. So it's probably one of the most heavily researched area of chiropractic. So is chiropractic care for kids legit? Well, I mean, like we've got a journal that comes out, the International Chiropractic Association, just solely for pediatrics. So go ahead and read the science. Take a look at it. So yeah, so chiropractic care for kids, it's safe, it's recommended, and there's no harmful effects of it. So take a look at it. So let's go back to the question now. So what's the difference when you adjust a child versus adjusting an adult? How do you know what you're doing? What's the difference? Well, here's the main difference. When we talk about kids, like younger kids, pre-puberty, they don't have the muscle tone an adult has. So when we go to adjust an adult, we have to like kind of get in there, put a little ump in there, kind of do a quick, fast thrust in order to do the chiropractic adjustment the way we do it. With a kid, you don't need to do that. They don't have the muscle tone to fight back and resist you. Plus, some of those bones are still forming, so we don't want to get over aggressive in these areas. So what we do here is we do a thing that they call sustained contact. Now, what is sustained contact? Sustained contact is when I put my hands on the spot and I start to put gentle, steady pressure. And eventually, I'm stronger than the child, and eventually the kid will just go into place. There's no quick snap or a quick thrust into it. It's just a steady pressure at the joint and it'll go. Now, what happens is these kids, they keep growing, they keep getting bigger and stronger. And so eventually they hit an age. Like I have a young man that comes in here, he's about 13 or 14. He's a football player, kind of a big kid. And so when I try to do that to him, it doesn't really work. So what we do is we take it as far as we can with the tension, and we just do a little tap. Not a big thrust, a little tap. And if it doesn't go, then we try a little harder. But that's how we difference between a kid and adults. With an adult, we don't do that steady pressure. Now, we do that with a 85-year-old osteoporotic patient. We kind of treat them the same way we treat the kids. Um, but the difference is when you have a kid in here, you do the adjustment. The kid has like an instant relief. The kid like instantly knows something happens because they're not walking around with 30 years of stress. They're not walking around with 20 years of misalignment. They're not 20, so they don't have these problems as long. So their turnaround, their results are so much faster. So that's the other big difference taking care of a kid and adult is that the kids, we get like super fast results with. I mean, as soon as we start adjusting them, we notice neurological changes right away. The kid can move and bend, twist, and balance and proprioception. Everything gets so much better, so much faster in an adult. In adults, like a slow, gradual improvement. With a kid, it's like boom, they get off the table, and it's like they're so much better. So that's the fun part of taking care of children is because they don't have all those years of all that degeneration going on, all the years of stress. So the results are so much faster. Now with babies, we do take care of babies, and why would a baby need to get adjusted? Someone says, why would you need to see a kid like that young? Well, we go back a lot of times. You'll see a lot of stories and articles written about the birthing process where there could be pulling, yanking. I've been at this for almost 20 years, and I find that most kids come out pretty perfect, right? So, especially the more natural the childbirth is, the less they need us. So we just kind of do a quick check, and most kids we just dismiss them right away. We don't even do much with them. But the couple of kids that come in and maybe have a upper cervical, that's your upper neck area, or maybe a pelvic issue. Those are the two most common things in newborns. Well, we have a whole different way of analyzing and doing their evaluations because you wouldn't take an X-ray of a newborn per se, right? Unless there was something really big going on. You don't really X-ray the newborns. What we do is because they don't have any muscle tone, we can hold the child in certain positions, and we'll see the way their head bends and twists. And we go over all that with you before we start, so you can actually. A lot of times, the dad will jump up and help me find the problem, kind of like be my assistant that day. With our newborn kids, as dads, we don't have a lot to do with that, so we try to jump anywhere we can jump in. And we also have a hip check we do. What we do is we just we have a couple of spots where we kind of squeeze them and not squeeze them, but we kind of push their skin together, and you can see the ways it deviates left or right. It kind of tells us what goes on with the hips. And again, when we adjust a newborn baby, it's just me putting my fingertip on the spot and just installing a little bit of pressure, and it just kind of glides right in. Otherwise, maybe we'll shake our finger a little bit to get it. And same with the hips. We don't like we take care of the Rockford Ice Hogs, the AHL hockey team for the Chicago Blackhawks. We would never take a newborn baby and dress them like we do in the locker room at the ice hockey games, right? So totally different technique, totally safe. So that's kind of the question we ask, like, what's the difference between a kid adjustment and adult adjustment? One, the kids, it's just a little bit of pressure, not so much of a thrusting force for the adjustment. It's very mild, very gentle. Most kids, they tell you they like it. There's always that one kid that's a stinker that doesn't like anything, but most of the kids like the adjustment. The second thing is the results. The results are like boom, like instant, like we see them right away. And the other thing that's different is the way we do the analyzing. So most adults, like I said, we X-ray their full spine, we see what's going on with them. We know what we're going into. Most kids, some of these bones are still growing and forming. So a lot of taking a whole bunch of X-rays over and over again isn't always the case for children. But we have other tests we do designed for the kids based on their age, the way they bend, the way they twist, the way their feet line up and stuff like that. So a lot of times we become more reliant on the testing for the kids than we do the films. And it's like I said, for newborn, we're not going to X-ray a newborn, but we will if we have to. But for the most part, we have other checks and things that we do. So then the other question was asked, well, how do you know when to transition them from a childlike adjustment to an adult-like adjustment? And I'll be honest with you, this all depends on the kid. I mean, Dr. Burfin's here, and I believe he said when he was like 14, he was already 6 foot tall. And his mother got a job at a grocery store to keep feeding him because him and his brother were growing so much. They kind of, it was easier to work at the grocery store and take the discount than it was to try to buy the groceries. So I bet you his chiropractor started adjusting him at a really young age, like an adult. Where somebody else, they don't hit puberty until they're like 17, and we're going to do things a little different, a little more mild. So it all depends on the kid and what the kid's up to. And not only that, but like my daughter's a cross country runner, and she runs and runs and runs, and that really does a lot of stress on the hips. So I might adjust her neck like longer like a child than I do her hips more like an adult. So it's even different on the spine. Some spines need it right away. Some spines can wait a while. But that's kind of the difference between adjusting a child and an adult. And how do we know when to switch over? Well, it depends on the kid. Depends on the adjustment's going. Most of the kids, we treat them like kids until they're, hit puberty. Then we get a little bit more like an adult, visit by visit by visit, as they get older and they get more mature, and they start to behave more like adults, at least maybe, physically like an adult. We adjust them more that way. So that's kind of how we take care of kids. And that's kind of the difference between taking care of a kid and taking care of an adult. So I hope that answers the question, and thank you for the question. And that was a patient came in and had wrote it down and gave it to my staff and asked us to kind of review that on this podcast here. So If you have a question that you'd like to see us answer, go ahead and leave us a comment below, and we'll be happy to get to your question. Or otherwise, you can email us, you can direct message us, you can always go to our website. It's Rockford, DC, ROCKFORD, DC, Rockford, DC, Dr. Chiropractic, RockfordDC.com. And you can hit some, contact us on that and send us a question if you're watching this or listening to this somewhere else in the world. We have taken this now into a podcast, so the podcast is played all over the world. As of this week, we are officially now an Apple podcast. So Apple, Spotify, or wherever else you listen to podcasts. Or if those of you who are watching on YouTube or maybe watching on Facebook or LinkedIn, just go ahead and leave a comment below if you have a question for us. The goal of this whole thing is to ask chiropractor a question about chiropractic. If you have a question on how chiropractors do things, I'll be happy to answer you. I am Dr. Brent Hosselbus here from Rockford, Illinois. Our clinic started in 1949. I'm a third-generation chiropractor. I'm a graduate of Palmer College of Chiropractic, Davenport, Iowa, and I work with different athletic teams. And I'm a member of the International Chiropractic Association. So if you have questions for us, feel free to ask away. Love your questions. Other than that, stay healthy, stay strong. See you next time around. Bye, everybody.